Okay, so Bezat Hashem, we're going to pick up where we left off last time. We're on page 283. Just to do a little bit of a chazara, a little bit of a review of what we spoke about last time, so just to get us back in the zone. So last week we started Hilchot Refuah b'Shabbat, Hilchot of medicine, of treating people on Shabbat, and we first started off with what is the source that one is allowed to perform melacha in order to save a life. And we had a list of number of opinions that were given, and we ended up with two of them. The second to last one was V'shameru b'nei Yisrael Shabbat. Let them keep Shabbat. So save somebody once, so he's able to keep more Shabbatot. The final answer that was given by Shmuel, I believe, was Shmuel was that it says in the pasuk v'chai b'hem, that you should live with the mitzvot, with the thing. So in order to keep somebody alive, that's why that pasuk allows a person to michalel Shabbat. We also saw that you shouldn't waste time. You shouldn't ask. If a rabbi is getting asked if someone's allowed to be michalel Shabbat for pekuach nefesh, then the rabbi is at fault for not teaching them, and the person who's asking it is considered a murderer, right? We then saw that even safek pekuach nefesh, right? We're not 100% sure he's really in a danger zone. We think he might be in a danger of. We said Michalel Shabbat as well for that. If we cannot ascertain it, there's no one else to ask, there's no expert to ask, and we think maybe it's pekuach nefesh, you're allowed to be Michalel Shabbat. You have to be Michalel Shabbat for that. We saw that if the doctor says he's at risk and the patient says he's not, you listen to the doctor. If the doctor says he's not at risk and the patient says that he is at risk, you listen to the patient. If the doctors are arguing, you take the side of the doctors that say that he's at risk and you be Michalel Shabbat for him. Unless there's an expert doctor and he is the one who says that he's definitely not in trouble, and other ones are just general, then you can listen to the expert doctor. We saw that also. What happens if you were Mechalel Shabbat and then you find out the guy was fine? You rushed him to the hospital. It turned out he has some gas and it wasn't a heart attack. So they'll say Patur, he didn't do anything wrong. In fact, the Shulchan Aruch says you did a mitzvah. You thought the guy was dying. You thought Pekuach Nefesh. You went and you saved him, even though it turned out it wasn't. You still get the mitzvah. That was the Shulchan Aruch. We continued, and we said, even if there are many doubts, we still save this guy's life. We talked about that sometimes if there's no doctors, you can listen to a stama person. If this person be a guy, this person has to be a Jew. We saw this machloket. We saw if it's a non-religious doctor, should we listen to him? Should we listen to a non-Jewish doctor? Maybe they're not that much attuned to Judaism as well as they're being overcautious. So maybe you cannot really listen to them. But it turns out, lahalachad, that if any doctor is saying that this guy is at risk, we are going to listen to it. And anything that a normal person would be worried about is considered a situation of pekuach nefesh. Okay, we did talk about one other topic, that if the patient, we know the patient's disease, and the doctor says a certain therapy is going to work, and the patient is arguing, and the patient says, "No, I want a different therapy." We don't listen to the patient. If the patient says, "I want a certain medicine," and the doctor says that medicine is not good for you, we don't listen to the patient. We listen to the patient that he's in danger, but we listen to the doctor of how to treat him. We saw that. And then we ended up that anyone, a person will get scared about, a situation normal people get scared about, that would be the situation of pekuach nefesh. So now, that was just a review from last week. Now we're going to get in to examples. We're on page 283. And the Tzurba Rabbanan, volume 21, are on page 283. And we're going to give examples of cases of pekuach nefesh. Okay, so the first source 18 tonight, page 283. I think we saw it, but we're going to see it again. Let's take a look. Says the Gemara. The Amar of Adabar Matla Amar Rav Gav Hayav Gav Regel. The person had an injury on the top of his hand or the top of his foot, where the blood vessels are. Okay, so if the blood vessels on the top of the hand or on top of the foot, and you get an injury there, it's very likely it's going to get infected. All right. So even though it's an external injury, it can turn out to be something very critical. It's as if it's an internal injury, and it could be life-threatening. And you mechalel Shabbat for a wound, gav hayad, gav hareg. Omer Rav Shemin bar Abba Omer Yochanan. V'hai ishta timirta kemake shel chala. Umechalin aleyas Shabbat. Someone who has a high fever is considered as an internal injury, and as such is considered pekuach nefesh. You can mechalel Shabbat for someone with a high fever. And continues the Gemara, and the Gemara says we're on page 283, source 18, second paragraph. What is considered an internal injury? Where does it start from? What part of the body? So, Peirash Rabbi Ami explained, Min hasofal v'lifnim, from the lips inward. So from the lips inward is considered internal, and the person has an injury in that, you can be mechalel Shabbat. By Rabbi Elazar or by Rabbi Eliezer, koche v'shine mai. What about gums and teeth?
Well,
why? What's the question there? I thought it's inside the lips already, right? Kivan da'akusheninhu, since they're hard, kemake devare damu. Maybe they're like external afflictions. Maybe because they're hard, they're not as dangerous. You got a cut in the mouth, whatever. It's not the end of the world, right? It's not considered like a real internal injury. Kemake devare damu. Kivan de gavai kaime. Since it's inside the mouth, right? So that was the question, and the Gemara leaves at that question. So you told me internal injuries are from the lips inward, question on gums and teeth, and the Gemara leaves it at a question. But let's take a look at the Shulchan Aruch. So on page 284 in the Tzurba, on source 19, the Hainu, if it's from the teeth inwards, Shinaim Atzman B'chlal, says the Shulchan Aruch, teeth are also considered part of an internal injury. Umechal in aleyas Shabbat. You can be mechal Shabbat for a tooth injury. We're going to define this shortly, what it means, a tooth injury. So let's take a look at the Ran. The Ran is very, very, very important. This Ran is going to help us define what we're talking about. Says the Ran, source 20, V'chasav Rashba, B'shem Rabbi Yobeinu Yoina, Daha Da'amrinan, Dev'maka Shel Chala Mechal into Shabbat. Whenever we said it's an internal injury that you can mechal Shabbat, Davga V'shenitkalkel Echad Min Ha'Ivarim HaPinimim Machmas Makov Abua V'Chayotze V'Zeh. It's only if there's damage due to the wound or the abscess or something similar to that. Meaning, it's not just a pain. It's not just a pain, but rather there is a ruination from that pain or due to that pain, or that ruination is causing the pain. But it's not stam, something hurts me inside over here. Oh, okay, let me mechalel Shabbat. It has to be something that's legit. But he writes, of a mechushin, ein nikra'in maka. Ve'ein mechalin is a Shabbat. Because someone has a little ache inside him, that doesn't make it an internal injury to be mechalel Shabbat. So, right. So is arthritis pain something that's pekuach nefesh? No. Okay. So let's take a look at the Bir Halacha, and from this Bir Halacha, I'll take a look at a couple of dinim inside just to see. So the Bir Halacha says, he says Rashba, it says the Ben Yonah, he brings this whole thing that we just saw. Then he writes in the second paragraph, right? If it's really hurting him, so says the Bir Halacha, if it's hurting and you're not sure why it's hurting, right? And it might be serious, it might be not. You should be mechalel Shabbat. Why? Because safek pikuach nefesh you mechalel Shabbat. So we're going to see this in a second. So the ideas that come out as follows. These are the important ideas that come out from this Ran and this Bir Aloch. The Ran makes it clear. The Ran makes it clear that it's not just any internal injury. Oh, it hurts me a little bit inside. I have to mechal Shabbat. No, it has to be an internal injury that's an internal injury. Now, the Bir Aloch seems to be saying that sometimes the pain is telling you that there's an internal injury, right? Person has an appendicitis, right? So I'll talk to my example. In 2023, October of 2023, it was right after Sukkot. All of a sudden, I was in very, very much pain, and I thought it was just I had something bad to eat, and I had I went to the bathroom. I was on this, it was that, but it turned out the whole night passed by, and I couldn't sleep even 2 minutes. At that point, I realized that it wasn't anymore just a regular internal ache. I realized my pulse was off, my heart rate was off, my blood pressure was off. So I took myself to the hospital. My wife drove me there, and we figured out that my appendix was about to go. So I had to perform surgery to remove it. So what was going on there? The pain in the body indicated there was an internal injury that had to be dealt with. So a lot of times, if you don't know where the pain is coming from, right? So if some person has arthritis, I know what the pain is. I don't have to be Michal Shabbos for that. But if it's something that may be dangerous, right? That is considered enough if it's pain. So it's an internal injury, right? That you Michal Shabbat. Pain could be an indication of internal injury. So if you're not sure that it's not, you should be Michal Shabbat for that pain.
I had the same thing.
Yeah.
In Erev Shabbat.
It was Erev Shabbat. It was an appendix also.
By me was enemy is going to blow up.
Oh wow!
And they needed to do the surgery right.
Emergency surgery.
Emergency. I went to the doctor just for check because I was like you saying,
right?
With a lot of pain. I was waiting, and I thought maybe just a pain.
I was bent over. I couldn't even stand straight. That's so painful.
My wife, she said you have to go to the doctor, so make an appointment. And I went to the doctor.
Right.
Doctor checked me, and
they go to the hospital
after he had like a screen. I don't know, screened me, whatever. So he knew like something. He told me, "You go to the hospital." I said, "What? Erev Shabbat? Can't wait for Sunday." Right now.
Yep.
And he gave me also a doctor, surgeon, everything.
Take care of it, yeah.
So I called my wife. She came and we spent Shabbat together.
Oh, Shem, you're here with us. Now, the Torah of this is the Ramban. The Ramban says what we're saying over here. The Rambam says, but if we know, umakirim, and we realize, but oto choli, shehu, if you know the guy has an internal pain, he broke his arm or whatever it is, and if you wait, it's like 20 minutes before Motzei Shabbat, and if you wait 20 minutes, nothing's going to change at all, then he cannot be Mechalel Shabbat. Even if he has something else that happened earlier in Shabbat, and if he waits, right, and he can tolerate it, it's not like the end of the world, and it's not, then he has to wait. So if you know that you can wait, then he cannot be Mechalel Shabbat. If you can't wait, and it's something that's dangerous, or you're not sure if you can wait or not, then you could be Mechalel Shabbat. So that's what comes out of these sources over here. Let's talk about teeth for a moment. So we did speak about teeth. So what is halacha l'maisa when it comes to teeth? So halacha l'maisa is brought down over here in the Rabbi Nachshon Sefer on page 291. One who is having an intense toothache on Shabbat and needs to have it extracted may have the tooth removed by a non-Jewish doctor. Okay? However, if you're experiencing intense pain and it is not being solved by taking painkillers, such as in the case of an abscess, a pus-filled infection that causes severe swelling, then it's considered pikuach nefesh, and even a Jewish doctor can take care of it. Okay? So it's not just stam pain. If it's just pain, then it's not considered pikuach nefesh. Okay, so if you really can't tolerate it, a non-Jewish doctor can take it out. But if it's pikuach nefesh because it's an infection, it's swelling, it can then lead to the rest of the body, that's a pikuach nefesh, and even a Jewish dentist can treat that on Shabbat. Stomach pain. We talked about stomach pain. So what's halacha l'maaseh when it comes to stomach pain? Sometimes stomach pain can be life-threatening. If there's a sudden sharp stomach pain, right? If there's pain in the lower right part of the stomach, we talked about appendicitis, right? So these type of cases, they require medical attention. So if you're not sure that it's not a problem and you feel that it's really dangerous, person should be mechalel Shabbat in order to get it treated. Okay. Well, let's just take a look at one more halakha from over here before we move on. He writes over here, a person who has an internal illness could be anywhere. We talk about lip inside. But if he knows it's not actually life-threatening, then he cannot be mechalel Shabbat. One could violate Shabbat in order to save someone from becoming blind or deaf or developing a debilitating mental illness. So someone can go through some tragedy that might lead into a mental illness. You're allowed mechalel Shabbat to prevent that. Okay.
Well, mental illness could happen just in a minute.
From developing a debilitating mental illness. I don't know exactly, but that's what he brings over here. We'll see more a little about mental illness shortly. Page 285, source 23. An injury or acute sudden chronic illness which affects an internal organ, heart, kidney, liver, lungs, prostate, stomach, is automatically considered life-threatening unless we definitely know otherwise. So if something's happening inside the body, unless you know 100% it's not a big problem, then you have to assume that it might be problematic, and you be mechalel Shabbat. If there's pain inside an internal cavity, then usually the pain is an indication that something is going wrong. We could be mechalel Shabbat. Okay, same thing. If a person has medications, okay, and for life-threatening diseases or life-threatening issues, and he runs out of the medication, and he needs that medication on Shabbat, it's life-threatening if he doesn't have that medication.
Yeah,
He can go get that medication.
Ooh.
Give me Halel Shabbat to go get that medication, because without that medication, it's life-threatening. It's a kuach nefesh. All right. Fine. That's internal organs and those that are similar to internal organs, internal injuries. Let's move on to another case that the Gemara brings down. The Gemara brings down in source 24, Omar Shmuel. Shmuel says, Hai Pid'ata, the wound that is caused by a sword, a metal instrument. Sakantahi, it's considered life-threatening. Umehalilin aleya et Shabbat, and we desecrate Shabbat for it. Okay, so fine. That's what the Gemara says. The Gemara says metal injury for metal, you can be mechalel Shabbat. Right. So says Shulchan Aruch in source 25, Chalalin Shabbat al kol maka shenasit mahmat barzel, that happens because of metal. That's what the Shulchan Aruch says. So any makkah that happens because of metal, what's the issue? Person gets a cut with a knife. What's the issue?
Inside.
Right. That's right. You can get an infection from that. So you have to be very careful. An infection in the blood can lead to an infection in the whole body. The kuach nefesh. Says the Shmirat Shabbat Kilchata, in these instances, even before the Reifa says that it is dangerous. What's the cases? Patza Amuk, he has a deep wound or a cut caused by a nut or other metal object. A powerful wound caused by metal or a heavy object such as a stone. All of these can be considered life-threatening. So the question that I got was, a guy was trying to open the window, and the window slammed on his hand. It didn't cut him.
The glass?
No. The metal part, the bottom part of the window, landed on his hand. It was metal. Okay? And it didn't cut him, but he got a big injury. He got swelling and stuff like that. Black and blue, whatever it was. So can he not? Is Mechalel Shabbat, not Mechalel Shabbat?
Depends.
Gabriel says no. Chaim says
Depends. If it depends. If we can put the ice or something on it,
to stop it. Okay,
but
let's take a look.
if it's really broken,
You're saying if it's a broken bone,
yeah.
is a broken bone? Can Mechal Shabbat for a broken bone?
Today they do it because if you don't do it, it could be worse. I don't know.
Let's talk about a broken bone for a second. One who has dislocated a limb may desecrate Shabbat in order to treat it if a doctor deems it life-threatening. Okay. However, if it's not life-threatening, one may not desecrate Shabbat. If there's an immediate need, a person may desecrate Shabbat in order to treat a broken bone. So it must, if there's an immediate need to do it. If there's not an immediate need to do it, then you shouldn't do it. But if there's an immediate need to do it, then you should. So here's an example. Certain bones, if it breaks, it causes a lot of pain, especially if it's around certain limbs or certain organs in the body. If that bone breaks, be very painful. Pain can lead to shock, can lead to other issues in the system. But if someone, as Shalom, broke his
finger
or broke his ankle,
yeah, finger is nothing.
Once I took someone, we took it to the urgent care. We thought we were gonna, patch it up or give us a cast or something.
No, it's nothing.
They didn't get. They gave Motrin.
Yeah.
They said take Motrin overnight. Make an appointment to see the bone doctor in the morning or whenever you get to them, and they're gonna put a cast on.
Right?
It was for the arm.
For the arm. So maybe it was not broken.
It was broken. It's fractured.
Fractured. But
no, it was a hairline fracture, whatever they call it. Okay, and it was a real fracture. You have to get like for a couple of months. You have to have the cast.
But there's not much.
But they said not emergency. Just take Motrin. Also went with the foot. I took it there. They said no, just give Motrin. So if you know that for certain, you don't have to fix that right away. Then you shouldn't fix it on Shabbat. You can call it Shabbat for it. You have to know these things. If you don't know, or if you know that it's something that needs immediate, say that. Now, what about this case of the window? All right. First, I want to read to you about someone getting hit by a metal object. He may even put cream on the wound in order to avoid infection, because that's the whole pikuach nefesh over here. What about the window? So the Yalkut Yosef actually brings this window slamming case. So let's take a look at it. If a door or a window slammed onto someone's finger and a doctor claims that the person is in no danger, we abide by his decision, even if the door frame or window frame is metal. This is not the case of being injured by metal as mentioned, right? When we say, the Gemara says that you got hit by the metal, we're talking about a cut that can lead to an infection, right? If it's just a slam or something like that, and you can tell, either a doctor tells or you, a layperson can say that this is not really a pikuach nefesh situation, then a person cannot be mechalel Shabbat for that. Right. Right? It does not apply to a scratch or a cut unless it's a deep laceration. So I'm cutting the cucumber, right? And it slid a little bit and I got a little cut on the finger, right? That's not going to be considered mechalel Shabbat. We're talking about a cut that's dangerous, right? That can be mechalel Shabbat. Not just a little cut that a person gets on the finger or something like that from regular kitchen utensils wherein use of things like that. Okay, fine.
If a patient, if somebody had a fall, what do you think? They should go to emergency room or no? Sometimes you don't know it's bad till it's later. They feel okay in the beginning.
Okay, so I'll tell you, it's a very good question, actually. Okay, it's a very, very good question. So we'll say as follows. Falls, it depends on a lot of situations, but let's take a look at this. Especially if it's an elderly person, if they fall, it should be considered pikuach nefesh. They fall, they can hit their head, and if you don't treat it right away, it can lead to a stroke and other problems, and the person can have a very, very terrible outcome from a fall. We in the hospital, we have falls that happen with elderly patients. Sometimes it is deadly. All right, within hours they can die, and so you have to take a fall seriously. Now, if it's a kid running around and the kid falls, it's not the first time they fell, they fall all the time, and they're not falling from a very high height. So then it's not going to consider pikuach nefesh. Put some ice in it, tell the kid to sit down, and anyway, they're going to get back up in 5 minutes and fall again. So it's not. For most other adults, if they're falling, they can tell you where they hit themselves, right? If they say they hit just their back or just their this or just that, and you can trust them, right? Then you're not going to be Chal Shabbat as long as they're not in pain or anything like that. But if they fell and they hit themselves in such a way that it is the pikuach nefesh, they hurt their back, their spine, they can't move, right? Or they hit their head. These are definitely situations of pikuach nefesh, a person Chal Shabbat. And I'll say even one more point is that sometimes you be careful with the elderly. When they fall and you didn't see it, they sometimes lie. The reason is they feel that if they're going to say that they fell, they will lose their independence. The family will say, no longer can you live by yourself, no longer you can be like this, no longer that. They're going to put restrictions on them. And so they would rather say, no, nothing happened. I just fell in my rear. I fell on this. And then, no, nothing. I just slid. So you have to be very careful. So you have to really assess them to look to see if they have anything hit. And you should really maybe go to a doctor. So you really have to take a look at the situation. But it could be that sometimes a fall would be a pikuach nefesh situation that a person should be mechal Shabbat and get that person to the proper care.
What are the symptoms? Vomiting
and most times it's to really see if they really had any injury to the head. That's what you really want to see. Injury to the head or back, right? If they're complaining, they can't move, they can't see, they're not feeling well, stuff like that, that may be indication that it's a serious situation, right? The worst headache that they ever had, they can't balance themselves all of a sudden with different things, then you want to be taking that very serious. Okay, but very good question. Okay, let's move on. Now, we had the Gemara, it talked about a fever. And it said if a person has a fever, you could be Mechalel Shabbat. So now, what fever? How high does it have to be? So it says Rav Moshe in source 27. And he says there's no clear measurement what the fever has to be. Because the truth is, the al safek nami michal. We already know that if we have a safek pikuach nefesh, we're not sure. They got hurt, they didn't get hurt. It's going to be pikuach nefesh. Not going to be pikuach nefesh, right? We do michal Shabbat for a safek. Chol sha'adam choishes was that shemu cham beyoter michalin. Right? Whenever a person is concerned that he's exceptionally high, we michal Shabbat. And only when he's sure that it's just a small fever and nothing to be worried about, then you're not mechal. Stam b'nei adam, choishishin kishu karev l'midas mea v'shnayim. Most people get worried when the fever is 102, says Rav Moshe. Most of you looking around are saying that's not necessarily true. We're not really get scared when it's 102. 102, we just give Motrin, right? So we're going to see in a moment that many poskim argued with Rav Moshe on this. So says Rav Moshe, continuing Rav Moshe says, Shehu cham b'yoter, it's too much fever. V'lechein amidazo mechalin vein rashoyin lahachmer, you're not allowed to be machmer. Says Rav Moshe, if it's 102, you got to be mechal Shabbat. And even if it's not 102, let's say it's 101, and the person is worried, right? Then we can say, yeah, maybe he has a reason to be worried. He says, because sometimes, and this is also a very true thing, sometimes a slight fever can be an indication that there's an internal injury, that there is an illness going on in the lungs, in the heart. There's an infection brewing in the body, especially sometimes in the elderly. They don't get high fevers right away. At first, it starts as a small fever. You think it's nothing, right? Not realizing that small fever is actually a crazy infection going on. So says Rav Moshe, sometimes even a lower fever could be considered pikuach nefesh. You have to know the situation. Now, the Tzitz Eliezer says that Chaver HaRefoim Mumchim, I was giving them a shir, and I told them about Rav Moshe's 102, that people are worried about 102, you can Mechalel Shabbat. And Hitpilu Me'od, they were very astonished and they were laughing, and they said that it's impossible that someone would say 102 is dangerous. He says we shouldn't allow someone to Michalel Shabbat for 102. So the Tzitz Eliezer wants to say that Rav Moshe's 102 was too mekel, and 102 is not something to be Michalel Shabbat for, unless we know it's related to an injury or an illness or a disease that's the Pikuach Nefesh. But Stam 102 for a cold or something like that, person should not Michalel Shabbat, says the Tzitz Eliezer. And there's the Shal Shuva Shevet Levi, Rav Wozner says, he says, you can do it for ma'arba'im ma'alot, for 40 degrees Celsius, which is what in Fahrenheit?
101.
104.
104.
104. So according to Rav Wozner, the high limit is most people, anyone in the medical world knows already 104, right? This is where you're worried. Pas shalom, one time your kid's 104, and especially if you're a new parent, we'll say you're freaking out. 104. Should I take the kid to the hospital? So we took the kid to the hospital when we had 104 with my first child. Hey, 104, 104.5. Like, what to do? We gave Motrin. So he ran to the hospital, went to the emergency room. Get to the emergency room, they see us, and you know what they do? The big thing that they do for us, they give us more Motrin.
Oh.
They give us more Motrin.
What about for elderly?
In what case?
Let's say they have certain chronic conditions, so we don't 102, 103 can indicate a flare up or something, or some kind of a pneumonia, or
So Rav Moshe said that everyone would agree, a low grade fever by an elderly, where we're worried about a disease, that's it could be pikuach nefesh, could be Mechal Shabbat if we feel that that's necessary for that, because that case is different. But stam, we're talking about a cold and stuff like that. So I learned after that visit to the ER that all you do if you have a 104 is you give another dose of Motrin. Even if you gave one, you give one more. It's not to be the end of the world. Also, you can put the child into a bath, right, or something like that. Put the cold towel, or not necessarily cold, but just regular cold bath, cold towel, and it kind of would bring down a little ice packets around the body, and it will bring down the fever. It's not the end of the world, but the person still should be careful. Especially someone who is very out of the ordinary. All of a sudden, you have a healthy guy and he's 104 and he can't move and stuff like that. You have to worry for pekuach nefesh with that type of fever of 104. Rav Moshe was even more mekel, 102. And anybody who has a reason to be worried about even a slight fever should be Mechal Shabbat if that's necessary to save this person. The Shmir Shabbat Kilchatan now brings a whole list of other cases that's considered Pikuach Nefesh. So let's go through them. A high fever with feeling sick, where the fever is not yet to be determined. We don't know. So high fever. We saw this, 104. Even a slight fever in babies or elderly people, okay, which could be caused by a disease in the lungs or an internal organ. And you're usually concerned for such a thing. Mechalel Shabbat. A strong internal pain. If you don't know where it's coming from, suffix, pekuach nefesh, mechalel Shabbat. A deep wound or a cut caused by a knife or other metal object. We saw this. It could be an infection, and it can become a pekuach nefesh case. It could be mechalel Shabbat. If you got hurt on gav hayad, gav haregel, right, where the blood vessels are, which can cause an internal issue. Also, Mechalel Shabbat. Heat stroke, sunstroke, serious burns, right? Burns from chemicals, in sensitive places of the body. It could be Mechalel Shabbat. If someone is sensitive to a sting of a bee, a hornet, or the like, and he's stung, right? So he has like allergies, right? He also could be Mechalel Shabbat if it's life-threatening. It could be Mechal Shabbat. In fact, that's why I mentioned from the Yalkut Yosef outside for a moment. Yalkut Yosef says, once a person has been bitten by a snake or a dog, it's permissible on Shabbat to catch the snake or dog, even if one kills it in the process, in order that it can be examined in the laboratory to determine whether the snake is venomous or if the dog has rabies. The animal may be carried through Reshut Rabim, so the patient will receive proper treatment. So if you got, it's a pekuach nefesh case mechalel Shabbat for even catching the dog and stuff like that.
If the owner of the dog said the dog is vaccinated, it's okay. Does the person still pikuach nefesh, or you could wait till after Shabbat to get antibiotics or something?
If we can, I guess we can rely on the person. If it's a domesticated dog, usually they are vaccinated. Am I assuming wrong? I assume that most dogs that live with people are vaccinated, because otherwise
I
it's very
got bit
dangerous.
recently, but in a patient's home.
Oh,
So
yeah?
a small dog bit my
Okay.
leg, but they said the dog was vaccinated, so I
Okay,
just
so you
took
gotta check-
antibiotics in case.
So you checked it out, and was you okay, or
No, it bit. I didn't get it checked by a doctor. I just had prescribed
you got
antibiotics.
prophylactic? Prophylactically, you took some antibiotics.
Exactly. Yes.
Okay.
Yes.
I mean, I would assume that the dog lives with people, usually they probably are vaccinated. But if you're not sure, or you have reason to believe they're not, it's a case of a kuach nefesh. Yeah. For Shlema. It's a case of kuach nefesh. Poisoning. We're going to see this. Poisoning. If someone got poisoned, he took too much medicine, or he caused poison, he drank something that's poison. Right? Michalel Shabbat. Of course. Michalel Shabbat for that. Okay, hold on a second. Next, anyone who drank poison or took too much medication, right? You can mechalel Shabbat for that. Next, he has over here loss of consciousness, shock or suspected shock, resulting from a heavy weight falling on a person, from an extremely strong pain, a disaster, a terrorist attack, or electric shock. All of these are pekuach nefesh cases, and a person has to be mechalel Shabbat to take care of this. Allergies. Someone has a food allergy and he takes the wrong food. Chalel Shabbat, if you have to, for this person, right? Furthermore, he brings more cases here. Someone, okay, we saw this one already. 26, 27. We talked about the bone, right? Okay. 31. Let's see, 31. Okay. Okay, I want to get in that soon. One who has lost a limb may have it reattached on Shabbat, even though there are many malachot that need to be done in order to reattach it. Someone's finger got cut off. No, say someone's finger got cut off.
No, and you have the finger, yeah.
Take him to the hospital, get him stitched up.
No.
Okay. Furthermore, he brings over here eye injuries or illness. If it's not a regular pink eye, but some other eye injury, the person cannot see all of a sudden and things like that, infection or has a lot of pain in there, loss of vision or a cut in his eye, he should seek immediately medical care. That's another case of a pekuach nefesh. Yeah, it can be a lot of different things. Person has to be careful. We talked about stomach pain. Okay, we talked about that. He brings over here, you person may desecrate Shabbat as needed when one is trying to locate a lost child or person who could be in a life-threatening danger. An older person with dementia that went missing, you don't know what's going to happen to him. Or a child who went missing, shalom. Right? It's a case of pekuach nefesh. In Mechalel, Shabbat for them.
What about gout pain?
So, it's not pekuach nefesh. No. Is it? It's not pekuach. Okay, fine. These. Oh, so kidney stones, is that a pekuach nefesh? He says it is. Okay.
I passed five times over.
So
Take the.
so he doesn't bring here kidney stones as it, but it could be depending on the person. If it's pekuach nefesh, that he can't stand it and his vitals are all over the place, and it's dangerous for him, right? So maybe it is pekuach nefesh for the guy.
Once it happened on Rosh Hashanah,
Oh wow.
I was climbing on the wall, but take 5 doses, whatever it is. And that's it. Knock yourself out. And that's it.
All right. Let's move on right now. Okay. The next question that we deal with is, for whom do we violate Shabbat?
Any Yehudi.
Even any Yehudi or only Yehudim? So let's take a look. Starting with the Gemara, Masechet Yoma, on page 290, source 31. Matzu Chai Mifakichin. If you found him alive, you save him. The Gemara says Matzu Chai Pshita. Of course, if you found him alive, you save him. What are you going to do? Not save him? The guy's alive. Save the guy. Like Tzicha, the Afilu, the Chayesha.
For 1 hour.
Even if the guy's just going to live for another hour. You're allowed to Mechalel Shabbat, even if this guy's not going to make it through Shabbat. We're going to see that in a second. Right now, we're saying even if the guy's not going to make it. If you find the guy and he's crushed, we're going to save him, everything we can do, even for those little minutes that he will be alive. Now, we saw it said V'shamaru b'nei Yisrael. Keep him one Shabbat, he can keep many more Shabbatot. So you might think, if I save him now, he's not going to be able to keep any more Shabbat because he's going to die anyway. He's a goner. He just got 5 minutes, 10 minutes, 20 minutes, half hour, an hour, 2 hours max, and he's gone. So maybe I shouldn't be saving him. So says the Biur Halacha, that's only drush. That's only an explanation. But la halacha, aval ledina, loy tolu klal b'mitzvot. Deina tam d'dachim mitzvah achat b'shvil harbe mitzvot. El dachinan kol mitzvot b'shvil hayim shel Yisrael. It's not that we save the guy so he could do more mitzvot, or save the guy could keep more Shabbat. That's not the reason why we're saving him. We're saving because he's a Jew. That's why we're saving him. We'll save him as for however long he could be alive, just because a person, a Jew, requires to be saved. According to this, even a child, even someone who will never be able to do a mitzvah, someone who's deaf, someone who's a shoteh, someone who is not involved in mitzvot, mechalelin alehen. We mechalel Shabbat for them. Every type of Jew. We already saw last time, even the fetus that's in the mother, it's not even a day old, right? Mechalel Shabbat even for that fetus, right? For every single Jew. Now, what about Chas v'Shalom, Chas v'Chayyim? You should never hear about this. But unfortunately, many of us may have been involved in such a situation where someone tried to commit suicide. And they try to commit suicide on Shabbat. Kavim Mechalel Shabbat for someone who's causing himself danger. So Rabbi Gabriel said that the answer is 100% correct. You can Mechalel Shabbat for someone who's trying to kill himself. Says the Maharal Diskin, Delanios Dati on page 292. Someone wants to kill himself. We have to save him against his will. He's trying to kill himself. You have Mechalel Shabbat to stop it. Okay? Sometimes you'll have to. Sometimes you have to. Sometimes you have to. They do that in the hospitals too. They do that in the psych ward, doing in the hospital. If someone is a danger to himself or to others, we tie them up. We get an order for it. We have to make sure he's getting circulation, he gets everything else that he needs, but we tie him up to the side of the beds. No choice. The guy's going to kill himself, he's going to hurt others. It's a very dangerous situation. So, same thing here. The Birkei Yosef says same thing if someone took poison. You violate Shabbat to save him. Someone's planning to commit suicide. You can also Mechalel Shabbat to stop his plans. It's a very dangerous situation. Here, Rabbi Yonatan Rosenzweig brings in his Sefer Nafshi Beshelati, which is a pretty new Sefer, he brings a list of mental conditions, mental illness conditions, that a person can be Mechalel Shabbat for these type of people. Schizophrenia, psychotic disorders, bipolar disorder type 1, many cases of bipolar disorder type 2, and severe cases of clinical depression. All these cases, people can kill themselves or harm others. And so if you have such a person, it could be Mechalel Shabbat to stop them from killing themselves or killing others. He writes over here so much so that these people, sometimes they have a coping mechanism. They have a way to cope with the pain, with the depression, with the other psychotic issues. And sometimes the things that they use to cope include smoking. Look, page 293, so last paragraph on page 293. Smoking, writing, listening to music, driving, watching television, and more. All these things can be considered mutar for these people because they're potential life-threatening mental distress, and they might kill themselves if they don't have this coping mechanism. They would be allowed to have these coping mechanisms on Shabbat in order for them to not kill themselves. Mehalel Shabbat, even for mental illness. I'm going to take a look over here in the Rabbi Nachson. He brings as follows. One may violate Shabbat to say a person who is attempting to commit suicide, or for a person who put himself in a life-threatening situation as a result of his own negligence. Some instances of psychological disorders can also be considered life-threatening. If a person has homicidal, suicidal tendencies, and is on medication in order to seduce tendencies, failure to take medication is called a life-threatening situation, and one may override Shabbat in order to obtain them, just like the other cases. But there's a heart disease and he needs a medicine, he can Shabbat to get that medicine. Same thing here for these people with a mental illness. If it's going to cause them to get into a bad mode where they can kill themselves or kill others, Halal Shabbat, to give them what they need. Very, very scary, but very, very true. I was once involved in a situation where someone showed up on my door Friday night, and they were going through a severe breakdown, severe mental illness. And my wife, my kids were there, and it was very scary. Yeah, they had a very, very bad situation going on in their life. And for some reason, they decided to come to my house, my door. And I took the person to the hospital. Took them to the hospital on Shabbat. To the hospital on Shabbat. We got them some medication, got them medicated, brought them, they didn't keep them there. They said, just watch him, keep him close. I brought them back to my place. We kept them there. Although the person escaped on Shabbat from my residence, I couldn't force them to stay. Right? At some point, after the medication wore off, they ran out. I tried to get them back, but I couldn't do anything. But Hashem, a few hours later, they showed back up, and then was able to keep them calm for the rest of Shabbat. And after Shabbat came out, I was able to call some of the person's friends and family to come and collect them and get them to where they needed to get. Baruch Hashem, the person right now is much, much better. This was years ago. This was going like 8 years ago. So, yeah, so maybe even more. So, but it was a scary situation. But it was kuach nefesh. The person was in a very, very bad situation in life.
And you because you're a rabbi or because you're a nurse?
I'm not sure. I had a little kesher with the person, and the person felt comfortable to come to me. I was here once, and someone came to me also. It was a Monday or Tuesday morning. It was actually Chodesh Elul, very beginning of Chodesh Elul, a few years ago. There's a guy who lived here. He's not here anymore. I think his family took him to wherever they are. But one morning, I'm sitting eating breakfast with my wife. All of a sudden, there's a knocking on the door. I come and see there's this old man there. He's sitting there, and he's standing there, and he's telling me, "I need your help. I can't see. I can't this. I can't that. My heart's hurting. My sweating. This and that." I look at the guy. He looks terrible. He's like he's having a heart attack. Okay. And I tell him, "How'd you get it?" He says, "I drove here." I said, "You drove here? You can't see." I said, "Give me your keys." I made him show him the car keys. I took. I called Hatzalah right away. I'm playing around, and we got him. They came. They said he's having a heart attack. Took him to the hospital. He had a heart attack. Yeah. I took him straight there. I got his daughter. I called his daughter. I got this and that. So things happen. You have to know. Don't play around. If you don't know and you think it looks dangerous, right away call Hatzalah. Call what you have to call. Get it done. Don't play around. Don't play around with people's lives. All right. You have to take it serious. Let's go through one more set of halachot. We have 10 more minutes. Okay. Let's do the next one. What about saving the life of a non-Jew? Saving the life of a non-Jew. Or what about saving the life of a non-religious Jew? Someone who's Mechalel Shabbat befarhesia. We say someone Mechalel Shabbat befarhesia. He has some laws like a guy. Can we save him on Shabbat? Can a Jewish doctor, religious doctor, save a goy? So the Rambam says Meikar Adin. The Rambam says Meikar Adin. Look at the Rambam, source 38. Meikar Adin is bat ger toishiv mipnei she'anu mitzavin lahachayoto ve'ei mechalin alei et Shabbat. So a ger toshav is somebody who says, I accept the Sheva mitzvah b'nei Noach. Right? Went to Beit Din, they accept Sheva. Today you don't have ger toshav. You have no hide, but you don't have ger toshav. So the ger toshav, we have a mitzvah to keep them alive. But says the Rambam, keep them alive, yes, but not mechalel Shabbat. You can't mechalel Shabbat for them. That's someone who agrees with Jews, who keeps Sheva mitzvah b'nei Noach. They're nice. The Rambam says you can't mechalel Shabbat. However, the Ramban says no. The Ramban says yes, you can be Mechalel Shabbat for a Ger Toshav, for a guy who accepted the Sheva Mitzvot, B'nei Noach. But turns out that today there are no Ger Toshav, and according to everybody, Me'ikar Hadin, Ger Toshav is a guy who says, I accept the Sheva Mitzvot B'nei Noach in Bedin. Today there is no more Ger Toshav, for whatever reasons. It only applies when there's Yovel. Today's no Yovel, so there's no Ger Toshav. Every story, there is no Ger Toshav today. So Meikar Adin, you're not allowed to Mechalel Shabbat to save a goy. However, the Hatam Sofer already mentioned this back in the day. He said, "V'im yesh be'eva zo chashash sekonish nefashos yesh lahater afilu malacha deoraita." If it's going to cause eva, which is hatred, anti-Semitism. You didn't save my son, the guy says, I'll kill all the Jews. Right? We don't want that. That's pekuach nefesh.
They don't need a reason. They do the
Right. So give me the reason it's even worse. So it's pekuach nefesh for the Jews if you're not going to save a guy. Mechalel Shabbat, even doraita. However, the Mishnah Berurah didn't like this. Mishnah Berurah said there are religious doctors today who think they're religious and they're going and they're saving goyim. And he says, where are they getting this? Even if it's Ava, you're not allowed to save them. They're goyim. It's a deraita. Hashem yishmerenu. Hashem should protect them because they're being mechal Shabbos. I'm amazed at these doctors, these religious doctors. So the Chafetz Chaim was not having it. He didn't want religious doctors to be treating goyim on Shabbat. However, Rav Moshe Feinstein was very, very shocked by the Chafetz Chaim statements. Upela ala goyin Chafetz Chaim. How can the Chafetz Chaim say this? Because it's you could be Mechal Shabbat on purpose because there's Ava here. There's a problem. You know, imagine today a religious Jew says to a guy, "I'm not saving you because it's Shabbat." It's going to end up on the internet. It's going to fuel all these Free Palestine anti-Semitism movements. And the next thing you know, you're going to have a lynching and a mobbing and all these protests and things going on. You can't do these things. Says Rav Moshe, Mechalel Shabbat, to save a guy. If you don't want to cause Eva, Bizmanenu, Yesh L'chosh, L'stakana, you have to be worried for the sakana, not just for Jews here, for Jews here, all around the world. Right? You find it here and all around the world, they blow up.
If they call Hatzalah, the Hatzalah people.
Yeah. If you don't go, it's going to be Ava. They're going to make problems. You should know that a lot of goyim dafka call Hatzalah. Yeah. I've had in the hospital all the time. The goyim tell me, oh, we only call Hatzalah. Also, it's free. Right. And it's what they call fast. They say we call our ambulance, they charge the insurance, right? And they don't even come. They're not running through the lights and everything like that. So those who know Hatzalah, call Hatzalah's number. I had once a patient, a Goya. She said, yeah, I use Hatzalah, and I get Tomchei Shabbos, and I get other organizations. She had all these Jewish organizations. It's a black woman, and she had all these organizations. He said, I love the Jews. They have everything. You just need to know where to go. Okay, and you can't stop. If you're not going to give them is Ela. It's going to cause anti-Semitism, and it's problematic. Therefore, the Chipashish was very yesh l'don zeh. It's like on a mamish. Yesh lahater kishes namun zeh. It's permitted when such a situation occurs for a Jewish medical professionals to take care of goyim, and that same thing is true for non-religious Jews as well. What are you going to do? You're not going to treat a non-religious Jew? And then what? How are they going to take it? The next time a religious Jew walks in, you think they're going to take care of them? They're not going to take care of them. So therefore, we don't want to cause this rift and this fight. So Mishum Eva, we take care of non-religious Jews. We take care of Goyim as well. The Panini Halacha wants to mention another halacha over here, and he says, when you have a religious hospital, right, the best way to do it is to have the Goyish employees, right, the Goyish doctors and the Goyish nurses, they're the one who should cover the shifts on Shabbat. And this way, the religious Jews can have off, the Jews can have off for Shabbat. Because
how you do it?
That's how I do it. Yeah. That's how I do it.
That's why you don't hire Jews.
we have being recorded, but we have to make sure that all shifts are stacked. So if you think about it this way, if you have 15 nurses for a shift, right? You have 6 nurses have to be on. We have a roster of 15. If I'm going to have 8 religious Jews, then when it comes to Shabbat, I only have 4 people working, and I need 6, right? And you have to realize that there's Yom Tovim as well. All of a sudden, everyone's out for a 3-day stretch. Who's working those 3 days, right? Who's working those 4 days?
You don't know.
So what we have to do is we have to make sure that all shifts are accommodated, and because of that, I can say this: it is hard for Jewish medical professionals to get positions in hospitals that are Shomer Shabbat. Right? There are certain contracts that you can sign them. Will be off every Shabbat and Yom Tov, but it's very limited.
What they do in Israel?
So some of them they have to work. It's Pekuach Nefesh. You're working Pekuach Nefesh. You're allowed to work.
Pekuach Nefesh, but you're getting paid.
You're not getting paid for that day. You're getting paid for other days. You're getting paid for that comes in also. That's a different thing. Payment is less of an issue. There's ways to go around the payment. But they have no choice. It's Pekuach Nefesh. Even doctors here, there's very limited Shomer Shabbat residencies, right? Every doctor has to do residency. There's very limited Shomer Shabbat residencies. So a lot of Jews end up doing non-Shomer Shabbat residencies, where they have to be in the hospital on Shabbat.
So the Pekuach Nefesh covers it.
Yeah. They also have to know how to do it. If it's Pekuach Nefesh, there's more than they can do for the patient. And that's what we're going to go through in the next time we learn how far, that's the next page 298, which activities are permitted for someone who is in Pekuach Nefesh. Can I write in the chart? Can I document on the computer? Can I lift the bed? Can I turn on the television for the patient? Can I turn on the lights? Can I shut off the lights? Can I do other stuff for the patient that are not necessarily, helping his life? And that's the next sugya that will come up in dealing with Pekuach Nefesh. How far do we allow to Mechal Shabbat for such a person? Okay, but Rabotai, we got a lot of definitions and a lot of clarity on these halachot of refuah. Next time we will pick up on page 298. Chodesh Tov v'Shavua Tov leKulam.
No, 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 no.